Welcome to this segment on psoriasis. I'm Dr. Pony Chang, the founder and director of River Clinic for Natural Dermatology and Cosmetic Wellness. There are many types of psoriasis, such as pustular psoriasis and gouty psoriasis. Today, I'll be mainly focusing on the most common type of psoriasis, which is plaque psoriasis. Psoriasis affects about 1 to 2% of Canadians, and it is most common in the drier climates or in the drier provinces, as opposed to, say, the more moist coastal maritime provinces in Canada. It is an autoimmune disease where stress and infection are well-known triggers for the various types of psoriasis. Normal skin takes about 20 days to mature. What that means is that from the lowest, most bottom layer of the skin, your skin cells mature and moves its way up to the top layer where it is then subsequently shed off. In a patient with psoriasis, this process is abnormally fast, taking just 3 to 5 days. This means that psoriasis patients is shedding more skin and also at a faster rate than a normal person. What this results in is the thick, silvery skin that we often see on the skin of psoriatic patients. Conventional medicine may use a topical steroid to help control the inflammation associated with psoriasis. They may also use vitamin D-derived medication to slow down the rapid maturation associated with the skin cells in psoriasis. In very severe forms of psoriasis, immunosuppressant medications might be used. Many of these immunosuppressants are actually anti-cancer medication, which can be very harsh to the body and cannot be taken for a long period of time. Therefore, oftentimes, patients with severe psoriasis are left with very limited therapeutic options. In Oriental medicine, psoriasis is called silver scale for the white flaky skin seen in psoriasis patients. It is understood as a disorder of the blood, meaning something to do with the circulatory system. In my treatment of psoriasis with natural herbal medication, I divide psoriasis into 3 main types. The first type is the blood heat type. This means there is a lot of inflammation inside your body. Western medicine recognizes that there are a lot of inflammatory mediators called TNF-alpha, often found in psoriatic lesions. This type of psoriasis, the blood heat type, tends to give you very red plaques, and it is also the type that has the most type of scales and the most thickness in the scales. This type of psoriasis is also very active. What that means is that new plaques and new lesions are continuously being formed. The way I treat this type of psoriasis is with herbs that have the property of cooling the blood. The second type of psoriasis is called blood stasis type of psoriasis. And as the word stasis implies, things are not moving. This type of psoriasis tend to have a magenta color, sometimes even a purplish tone. And sometimes these psoriasis plaques can actually be very painful. Unlike the blood heat type, which is very active and new lesions are being formed, this type of psoriasis seems to be pretty steady. Yet, it is extremely stubborn to treatments by topical medication. You've tried everything, but nothing seems to work. The way this type of psoriasis is treated is by using herbs that have the property of invigorating the blood, so that the blood is no longer being static, but rather flowing smoothly within your body. The third type of psoriasis pattern is the blood dryness type. This type tends to have a more dullish, pinkish color instead of the red or purplish associated with blood heat or blood stasis type of psoriasis. Also, this type of psoriasis, the blood dryness type, tend to not have too much scales. If it has scales, it is very, very thin, very, very little, almost looking as if your skin hasn't changed in years. It's always the same amount of psoriasis. It's not really getting better, but it's not really getting worse either. The way to treat this type of psoriasis is using herbs that have the properties of moistening the blood, so that as your blood becomes more nourished, it can heal the dryness on your skin and help you get rid of the scales on your skin. In addition to the 3 main types of psoriasis, sometimes we have combination patterns, meaning you can have 30% of the blood stasis type plus, let's say, 70% of the blood heat type. The way Oriental medicine treats psoriasis is by carefully observing exactly what kind of patterns make up your specific psoriasis lesions. We will collect detailed information of your tongue and do a detailed pulse diagnosis so that when we create an herbal formulation for you, it is specific for your body and specific for your type of psoriasis. One of the most difficult things about treating psoriasis, and most patients will attest to this, is that sometimes when things work, they work great, but after a while, medicine stops working. With oriental medicine, because each herbal medication or formula is formulated specific for you, and we can replace and substitute different medication at all times, we can always be one step ahead of your body's adaptation response. I would now like to show you some photos, some before and after psoriasis patient photos here that we treated at the River Clinic. Thank you for watching. For more information about River Clinic and how we treat various types of skin conditions, please visit us online at www.riverclinic.ca.